Okay, so I have a go ahead to begin. Okay. Okay. So once again, good evening everyone. Myself, Dr. Rijul Agarwal. I'm the orthodontic faculty at DAMS. So we are a month away approximately. The exam is on 19th April. So as discussed and based on the repeated feedback from various students, today we are going to have a MCQ based discussions. Okay. So I have prepared a few set of questions from various different topics of orthodontics. Some are basic, some are a little bit tricky, some are past questions, previous year questions as well. Okay, so do not go with, some are also multiple option correct based type of questions. Okay, so how do they frame it? My basic aim right now is to assess and help you judge your knowledge so that a quick revision can be made, and also you can internally inspect where you are lacking certain topics if you don't remember. So I hope I can have an active participation. Okay, in the comment section, if you can uh, give us the options, I'll be very happy and we can have a fruitful discussion. Okay, so beginning with the first question. So the question is, ribbon arch appliance was introduced by. Okay, I'm beginning with a very basic topic first. The options are Kingsley, Merrifield, Edward H. Angle, and Robert Ketchum. Oh, I just written Ketchum. So, what will be the answer to this question? So, the idea is I'll wait for 5 to 10 seconds before providing you with the solution and answer to this question. I know there is a lag from my end till the time it reaches there. Okay, so I'll proceed. So the answer is C. Yes, someone answered. It's C. Edward H. Angle. Okay, so doing a quick revision. Okay, so the contributors of Edward H. Hartley Angle, he is also considered as the father of modern orthodontics. He first gave the E arch, that is the expansion arch, in the early 1887. The important point about this E arch is that it was the modification of the appliance given by Pierre Fauchard. Okay, next, further he modified and gave the pin and tube appliance. Third was the ribbon arch, and fourth was the edgewise appliance, which we are till date using today. So quick revision and a quick images of these appliances are shown here. You have already gone through them in your class notes. Okay, so building on this very topic, the bandelet appliance is tied with. The options are silk thread, gold, stainless steel, or screws. So there are two aspects. First, the if I may ask, what is or who gave this bandelet appliance, what it is, and lastly the appliance is tied with. Mind you, it is also a PYQ as well. Okay, someone said B, cold. Anyone else? B. Okay, so sorry to say that the answer is not gold, it is silk thread. That's why I deliberately took up this question of bandelet appliance. I know why you told gold as the answer, because gold as a precious metal was cheaper at that time, but it was not used in bandit appliance. So that's why I put up two more questions on top of it. Who gave this bandit and what is the bandit appliance? So as I told you in the previous slide, the bandit appliance was given by Pierre Fauchet. So it was given by this Pierre Fauchet. So what it consisted of was a rigid stainless steel bar through which the malaligned teeth were tied using silk threads. So what happened, what the philosophy at that time was, that through the tying of this rigid arch wire, the teeth simultaneously aligned themselves through it. Okay, so it was first of all given by Pierre Fauchet. Now the gold thread, which I told you in the class, okay, was later on used by Edward Angle in his appliances. Why? Because gold at that time was much cheaper, it was much malleable, or you can say soft to tap. Okay, so the correct answer is silk thread. Please remember, it is I'm asking about banded appliance. Gold was later on used by Edward H. Angle for tying in expansion arches, pin and tube, and later on his appliances. Okay, so the correct answer here is silk thread. Now we have moved ahead with the second question, Dr. Rakshi. Okay, so I hope you are with me on these things. Okay, so this is the confusion or which problem where it occurs. That's why I deliberately started with the first question and moved on to the second question. First was easy, second a little bit tricky. Next question, which of the following are examples of active self-ligating systems? And please note, as I've already told you, there might be a possibility, I'm not conducting an exam here, so there might be a possibility that there are multiple options correct here. So in exam, what they can give you is option A, 1 and 2 are correct, 2 and 3 are correct, like that. So in the exam, you have to choose only one option in NEET. Okay, I'm just here to brush up your knowledge, to revise, and that's all. So which of the following are examples of active self-ligating systems? Okay, the options are innovation, smart trip, speed appliance, and Damon system. So which of the following is or are example? There might be one or more than 1, 2, 3, 4, or all 4 can be correct as well in today's my discussion. Okay, but in NEET you get only one answer option correct questions, so don't get confused with that. So there are two things, active self-ligating and passive. So someone said, Dr. Ruchi Gupta says A. Okay, B, B and D, C also, B and A. So coming to the question, so I'll tell you the answer. The question is asking about active self-ligating. So in self, what are self-ligating systems? A, B and D. Okay, so what are self-ligating systems? So traditionally the brackets, the wire was tied around with the help of a ligature wire or a module. So how it evolved into the self-ligation system consisted of a bracket. So imagine this is a bracket which had an inbuilt shutter attached to it. So instead of tying, you just insert the wire inside it. This is the wire, and the shutter comes down. Now this clip or shutter which is there, it can exert active force on the wire, or it can be passive as well. It can be active and passive. So when it's actively touching the wire, actively exerting force, it becomes active self-ligating. And when it is just passive, then it becomes passive. That means it is not exerting any active force on the wire. Okay, so which of the following are examples? So out of this, active self-ligating systems are innovation and the speed appliance, that is A and C. Smart clip and Damon system are passive self-ligating brackets. Okay, Damon system was given by Omco and Smart clip is by 3M company. लास्ट नीट उन्होंने डायरेक्ट कंपनी से रिलेटेड एक आपसे क्वेश्चन पूछ लिया था, ओके, रिलेटेड टू लिंगुअल ऑर्थोडोंटिक्स. विल कम टू दैट एज वेल. ओके, इंसिग्निया सिस्टम पे क्वेश्चन पूछा था. इंसिग्निया एंड इनकॉग्निटो, सॉरी इनकॉग्निटो वाज दिस एंड इंसिग्निया इज द रोबोटिक वायर वेल्डिंग. विल कम टू दैट एज वेल. दैट्स व्हाई आई एम डेलिबरेटली मेंशनिंग द brand names as well attached with these brackets. Okay, so I hope I am clear about this self-ligating systems. Next, a easy question. Again, a question like this has previously come in some other form in your exam. Catalan appliance is not given for a period of more than 6 months. Why? Causes attrition of upper incisors, causes periodontitis of anteriors, causes gingival recession in lower anteriors, causes over eruption of posterior teeth. So what will be the correct answer? As I have discussed with you, there can be multiple answers correct or single answer correct here as well. A very easy question which I have discussed multiple times regarding Catalan's appliance. D. Anyone else? So I suppose most of you, or you can say everyone who has given the answer got it right. It causes over eruption of posterior teeth. Okay, so don't get confused. I have written here 6 months, or the question gave 6 months. Technically it should not be used for more than 3 weeks. I don't think I need to explain anything in this question. So Catalan's appliance is also called as a lower anterior inclined plane. Okay, it is cemented on the mandibular incisors, used for the correction of upper anterior single tooth crossbite that is of recent origin. Okay, constructed at an angle of 45 degree to the maxillary occlusion plane. Now इस angulation का confusion generally लोग करते हैं आप लोग twin block के साथ. Twin block में the angulation is 70 degree. Earlier it started with 90, then changed to 45, and now currently it's 70 degree in twin block. Here the angulation is 45 degree. So किस appliance का angulation पूछा है, कहाँ पर पूछा है, उससे clear रहना. If they are clearly mentioning lower inclined plane, that means they are asking you about Catalan's appliance, not twin block. Okay, not to be used for more than 3 weeks. That's what literature said. Here question में उन्होंने 6 months दे दिया. But the concept where what they are asking is about this, that it causes over eruption of posterior teeth. यहाँ ड्यूरेशन पे क्वेश्चन ही नहीं है, तो यहाँ इस पे नेक्स्ट क्वेश्चन डाउट नहीं होना चाहिए आपने 3 weeks का आता है 6 months. ओके, अगर ड्यूरेशन पे क्वेश्चन आए so then it's 3 weeks. Okay, another thing, that is a removable inclined plane with bite rail is known as Bruckel's appliance, used for the correction of open bite. And tongue blade therapy is used for correcting anterior single tooth crossbite. Sir, can you tell why there is intrusion in Herb's appliance or there is intrusion or extrusion in Mara appliance, and how, sir? I'll get back to your doubt, Dr. Vivek. Just give me some time. I'll get back to you. If I forget and end the session, you can always tag me in the WhatsApp group as well, Facebook, WhatsApp, anywhere, and I'll answer it. Okay. So moving ahead, इसका तो आंसर दिख गया. So if anterior crossbite, next question, is not corrected with ice cream spatula, then the appliance indicated is tongue blade, inclined plane, Z spring, fixed appliance. So again, somewhat similar kind of PYQ. I just modified it. Now they're saying about ice cream spatula. So what is ice cream spatula? It is a form of tongue blade therapy only. I'll just give you a hint. Then the appliance indicated is tongue blade, inclined plane, Z spring, fixed appliance. Image is blur. This is the image of Catalan's appliance. I've already shown you in class. This is the image. Okay, coming to this question. B. So the correct answer is B only. Now they are mentioned here that it's not corrected with ice cream spatula. So both A and B can be used for correcting an anterior crossbite of developing teeth. Okay, fixed appliance of used for fully erupted teeth. Similarly, Z spring. Why? Fully erupted means try changing the quality. Sorry, I did not get you. Z spring and fixed appliance is used for a fully erupted teeth, means that the crown should be fully present or erupted inside the oral cavity for the appliance for a Z spring to be used. Okay, so please, अगर question में developing tooth recently erupted या age specific कुछ ऐसा आ रहा है that they have mentioned like 7-8 years की age है जिसमें crown fully erupted नहीं है, that means that the examiner is trying to point you towards developing teeth. It's not mentioned here whether the crossbite is fully developed or not. That's why I put up this question. इसका मतलब क्या है कि not corrected with ice cream spatula means we are getting growth period. I just get back to you. Now Vivek has asked a question that is question में there is no such mention about that a crossbite is of recent or developed or developing. Correct. It's not mentioned here, but यहाँ ये mention है कि not corrected with ice cream spatula means पहले we have attempted and the teeth is still developing. Examiner का ये twist करने का, this is the way they twist the question, that the examiner ने चारों option दिए, चारों are correct options for correcting a anterior crossbite. Okay, now they want to ask you कि भाई ये developed का concept स्टूडेंट को क्लियर है कि नहीं. ओके, नाउ द बिगेस्ट हिंट यहाँ है कि इज नॉट करेक्टेड विद आइसक्रीम स्पैचुला. दैट मीन्स दैट डेवलपिंग टूथ है, it was in developing stage, but no such attempt was made to correct it with ice cream spatula. That's why inclined plane is the best answer here or most appropriate answer here. Okay, now the next question which is here is, sir, can you explain the growth periods and orthopedic or functional appliance integrate those respective growth periods? It's very confusing, so just put up this question in the WhatsApp group. I can explain, because if I start explaining these things right now here, it will hamper our discussion on the MCQs. Okay, next question. Type of force exerted by a removable functional appliance: light, continuous, intermittent, interrupted, or continuous. So they're asking you about a functional appliance which is removable. What will be the answer? The duration of use of ice cream spatula BP. Now you are asking the duration. The duration is just जब तक क्रॉस बाइट करेक्ट नहीं हो जाती. It's not something a fixed. The child is just asked to use the ice cream spatula and pull the teeth out. जब तक वो क्रॉस बाइट करेक्ट नहीं होती. Once the cross bite is corrected, it's a self-retaining thing. Okay. Now the next question, the type of force exerted by removable functional appliance. So most of you got it right. It's intermittent type of force. So what are three types of force system? Continuous, interrupted and intermittent. So what is a continuous force? इसके example एक नाम से तो आपको सब you are now clear हो the most confusion जहाँ आती है वो है इनके examples पे जहाँ पर question बनते हैं. Continuous example is nitride coil spring and elastics which are operator inserted, or you can say E-chain, elastomeric chain. Interrupted, the force declines to zero between activation like screws, spring, etc. And intermittent, force level declines to zero when the orthodontic appliance is removed by the patient or when a fixed appliance is temporarily deactivated. Examples are removable plates, headgears and elastics. So, these are the elastics which example means the class 2 and class 3 elastics which the patient has themselves have to wear and use. Okay, and next question. All these teratogens are known to produce cleft lip and palate except. So a question on all except. So hence a single option correct question. Or aspirin, cigarette smoking, phenytoin, X-ray radiation. So what will be the correct answer for this? So you have to remember that table which I gave you in your class notes. This is very standard table from Profit. The teratogens and their mode of action, what they cause. So we have A, aspirin, इन टाइप के क्वेश्चन में इट्स अ डायरेक्ट थ्योरेटिकल बेस्ड क्वेश्चन जिसमें आपको कोई दिमाग नहीं लगाना, कुछ नहीं करना है. सो स्टूडेंट समटाइम्स आस्क मी कि सर हाउ टू मैनेज टाइम इन दिस एग्जाम की वो देयर इज अ पैटर्न लाइक चेंज हो जाता है ऑल दैट. इन दीज टाइप्स ऑफ क्वेश्चन अगर इफ यू नो अटेम्प्टेड, इफ यू डोंट नो स्किप एंड मूव अहेड. Because the more you ponder on such types of question, the more your time will be waste. तो इन क्वेश्चन में जिनमें डायरेक्ट थ्योरेटिकल बेस्ड क्वेश्चन है, डोंट प्ले तुक्का तुक्का एंड ऑल दैट. ओके, ओनली इन एंड स्पेशली नीट में देयर आर मेनी सीट्स एंड मेनी एम्स. INI बेस्ड में द सीट्स आर लेस. इफ यू आर एबल टू नैरो इट डाउन टू 2 अटेम्प्ट. इन नीट my suggestion is if you don't know, go move ahead. Negative से अच्छा है 0. Okay, so the correct answer is phenytoin. Sorry, X-ray radiation. Sorry, the correct answer is X-ray radiation. Cigarette smoking, phenytoin, aspirin, all these three causes cleft lip and palate. Okay, phenytoin is the other name of dilantin sodium. Okay, so this is a table: aspirin, cigarette smoking, dilantin, mercaptopurine, all causes cleft lip and palate. Especially cleft lip and palate के teratogens जरूर ध्यान रखना. ओके, एंड अभी ये जो एक रिसेंट में एक आया है जीका वायरस का, जो एग्जामिनर्स जो होते हैं अगर क्वेश्चन पेपर्स इज फाउंड अराउंड दिस टाइम, तो दे जस्ट जिसने न्यूज़पेपर एंड ऑल को थ्रू किया होगा, सो दे इसको एक एड ऑन पॉइंट की तरह ध्यान रखना, दैट जीका वायरस इज एसोसिएटेड विद माइक्रोसेफेली एंड ब्रेन डैमेज. अभी रिसेंट में इफ यू हैव गॉन थ्रू द करंट अफेयर्स, जीका वायरस का एक केस आया है केरला साइड में. ओके, सो ये तो ट्रेडिशनल है क्लेफ्ट लिप एंड पैलेट से क्वेश्चन पूछना. ये थोड़ा सा आज तक पूछा नहीं गया है, अनऑर्थोडॉक्स टाइप ऑफ क्वेश्चन है जीका वायरस, बट जस्ट रीसेंट करंट अफेयर्स में आया, दैट्स व्हाई आई एम हाईलाइटिंग दिस, बिकॉज इफ एग्जामिनर इज फॉर्मिंग दिस क्वेश्चन राइट नाउ, ही कैन पुट इट अप. Okay, the correct answer is X-ray radiation, all except. Next question. So given below are two statements. So what are the statements? First statement says that in orthodontic tooth movement, when two forces equal in magnitude and opposite direction same line are applied, it is known as couple. Second statement, couple forces will produce pure rotation movement of tooth. So in light above statement, choose the correct answer from the options given below. बहुत बड़ा क्वेश्चन, आई थिंक अप्रॉक्सीमेटली 30 seconds it will take for you to go through this question, but after going through this question you will realize it's just a simple question asking you about definition of couple and which one is correct or false. No assertion reasoning, just a simple true and false type of question. So जब डेफिनेशन बेस्ड क्वेश्चन आता है, सो दो तीन पॉइंट्स का जरूर ध्यान रखना है. अगर एग्जामिनेशन डेफिनेशन बेस्ड क्वेश्चन या ऐसे स्टेटमेंट दे रहा है जिसमें वो ट्रू एंड फॉल्स पूछ रहा है, तो उसमें हड़बड़ाहट में नहीं पढ़ना है. यू नीड टू गो थ्रू ईच एंड एवरी वर्ड, बिकॉज दे कैन ट्विस्ट और चेंज एनी वन वर्ड एंड उसकी वजह से पूरा स्टेटमेंट गलत सही हो सकता है. ओके, सो अगेन आई एम asking you to go through each and every word of the statement. 30 का 45 seconds होगा, उससे ज़्यादा नहीं लगेगा, 15 सेकेंड एक्स्ट्रा, बट आपका क्वेश्चन नेगेटिव से +4 की तरफ जा सकता है. सो अगेन आई एम आस्किंग यू go through them statements in the light of what I have just told you. And then answer. अगर किसी को, so I have got 3 students, so I said option A, that both statements 1 and 2 are correct. Anyone else? Okay, so I'll again start with the statement. Statement 1 says in orthodontic orthodontic tooth movement, when two forces, okay, two forces equal in magnitude, okay, equal in magnitude means equal in value, okay, and opposite in direction, okay, in same line are applied, it is known as couple. And may they have said this statement in same line. And what is the definition of couple? in same line or in opposite, that they should be non-collinear, equal and opposite, and last में they have written same line. if ये फोर्स ऐसे है, ये फोर्स ऐसे है, two forces equal in magnitude and opposite and same line are applied, means this is the line, उसी same line पे apply करती, what will they happen? They will cancel out each other. So what will happen? No couple. So as I have told you, each and every word in a definition based question is very important in any subject, because right now here the examiner is testing your knowledge कि कितना ध्यान से over the past 4 years you have studied your subject thoroughly through the textbook. So statement 1 हो गई हमारी incorrect. Next statement, couple forces will produce pure rotation movement of tooth. That's correct. So statement 1 is false, 2 is correct. कौन सा इसमें से जो भी मिले वो you can say here. 2 is correct, 1 is false. Option D. Okay. So the forces in couple should be non-collinear, not in the same line. Collinear means in the same line, non-collinear means not in the same line. Okay. So moving ahead. Match the following with their type. So a match the following type of question, I haven't figured out or made any options here. Okay, you just can write in the key what will be the correct with A, B and C and D. I haven't made any options. Okay, right now as I've told you, I'm not conducting exam here. I'm just brushing up your knowledge and revising the subject. So let's start with the first one. Next question, match the following. Twin block. So out of list 1 you have to match with the list 2. So what will be the twin option with twin block? 1, 2, 3 or 4? Binator with expansion, Frankel, skeletally anchored herbs. So in the comments you can write A, 1, 2, 3, 4, what, B, 1, 2, 3, whatever is your idea, and I will. Okay, so A with 4. Okay. Binator with expansion, Frankel, skeletally anchored herbs. So we have A with 4. A with 4. Okay. B with C1. किसी ने अभी तक B और D का नहीं बताया. B with 3. Okay, someone said B3, C1, D2, okay. So most of you were clear with A and C. That is A is a A क्या लिखा है सबने 4. Okay, passive tooth bone and Frankel is a tissue bone. मोस्ट जो कंफ्यूजन है एक्टिव टूथ बोन और हाइब्रिड में 2 और 3 के मोस्ट के साथ. स्टूडेंट्स आई हैव टोल्ड यू बिफोर एज वेल, कभी भी अगर हाइब्रिड अप्लायंस के बारे में दे विल आस्क यू, अगर इमेज बेस पे पूछे या कुछ भी पूछे, हाइब्रिड मींस उसमें कुछ स्केलेटली एंकर्ड कैम कंपोनेंट है, skeletal anchorage के लिए. In orthodontics, any hybrid appliance जो whenever it's made, be it pendulum, any kind of appliance, means there is a skeletal anchorage component and mostly it has tags attached in it. They can give you in the form image based as well. Last year जो image based में आया था उन्होंने एक hybrid appliance के बारे में पूछ लिया था and there was a panic कि appliance तो देखा ही नहीं है क्या है. Simple सा logic है. Hybrid means there will be a skeletally anchored component in it and mostly a temporary anchorage, a mini screw will be placed. Okay, so hybrid में क्या हो जाएगा, here है skeletally anchored here and this skeletally anchored appliance can be anything. Orthodontics में basic appliances कोई we are moving towards skeletal anchorage so as to reduce the anchorage loss nowadays. And bionator with expansion. Now traditional bionator was a passive tooth-borne appliance. Now they have put up an expansion screw. Now expansion screw aate hi what happens, it becomes an active appliance. So it's an active tooth-borne appliance. So इसके बेस पे जो भी ABCD नीचे ऑप्शन बनते हैं, you can figure it out yourself. I haven't found those options yet. Okay, so I hope my basic funda behind this question was to make you clear that anything, be it bionator, anything can be active as well if this word expansion screw or expansion is present. Okay, and supposedly इसी क्वेश्चन में another modification of this question, they give you this question twin block bionator और यहाँ expansion word नहीं होता, frankel skeletally anchored house बाकी सब सही. So how will the option answer not differ? Now the bionator will become the passive tooth-borne appliance. So अगर bionator passive tooth-borne हो गया तो what will be twin block then? Then twin block becomes your active tooth-borne appliance. 5. Why? Because traditionally, or you can say trend block की mostly जो whatever nowadays also twin block whenever we give it with an expansion screw. 90 to 95% twin blocks are given with an expansion screw in the maxilla. If you remember your class notes and images as well, there was an expansion screw present in that. Sometimes or rarely we give it without expansion screw, just 5-2%, but mostly we give it with expansion screw and hence it becomes an active tooth-borne appliance. Okay, so I hope I am clear now. अगर यहाँ bionator with expansion लिख दिया तो means examiner wants to test you or wants to ask you कि whether you know about this concept of active and passive or not. Okay. Moving ahead. इसका क्या? Negative growth curve is seen in. Options are thymus, testis, maxilla, and brain. So the question is related to Scammann's growth curve. Or instead of asking of you about lymphoid tissue and all that, they have given you examples like the way I wrote. So negative growth curve is seen in thymus, testis, maxilla, and brain. Lymphoid A. Okay, so most of you got it right. Okay, so thymus is a lymphoid tissue, hence the correct answer. Testis is a sexual or reproductive organ. It's a late maturer. Maxilla general body curve. Brain follows the neural curve. Okay, so this is the Scammann's growth curve. Another different way of type of asking question. So instead of asking options giving like lymphoid and neural, I provided you with examples of those tissues. Okay, thymus की जगह they can give you tonsil. Lymphoid tissue के जो example है, tonsils and also come. Okay. So most of you are aware from your pathology and physiology classes what are the examples of various tissues. I don't need to be important. So next, Milwaukee brace is used. I don't know if I've shown you the image of this, that's why I provided the answer. in this. So this is the Milwaukee brace. Okay, so traditionally it was not part of orthodontic therapy. It was a appliance used for the correction of scoliosis or a curvature in the vertebral column. So this is the image of the appliance. So what it does is it takes the help or anchorage from the lower jaw. So what used to happen? It led to the retardation of the mandibular growth in such patient. Okay, so what we have found, or what they have changed the question is that how it is used in orthodontic therapy. So it is used to stop the mandibular growth. How? Because of this anchorage support which is taken from the lower jaw, because of which the lower jaw is not able to grow in the forward direction. So it is used for correction, stop the mandibular growth, or you can say correct class 3 skeletal malocclusion or class 3 malocclusion. Anyway, they can form the question and change it. Okay, so this is the image. So generally this appliance is never used for correcting the lower jaw or stopping the growth of the lower jaw. It's just a way they have formed this question to test the knowledge. So whenever such appliance is used, occlusion should be protected using functional appliance or positioners. Okay. Next question. So what is crystal growth in orthodontics refers to? I don't know if I've discussed this or not. So it refers to lateral condylar growth, remodeling of basal bone, appositional growth, or bonding of brackets. So what is crystal growth in orthodontics? So what is, in short, crystal growth theory in orthodontics refers to? Someone said D, some say C. Okay, so students, as I've told you, this is again a direct theoretical based question. और अगर नीट में if you know it, you are sure, attempt it. Don't know it, leave it. Because एक negative mark में you can change your rank by thousands. Okay. So if you are aware of this concept, शायद सुना सा लग रहा है, ऐसा जो थिंकिंग माइंड में आता है, डोंट अटेम्प्ट इट इन नीट. बिकॉज 0 इज एनी डे बेटर देन -1. एक -1 आपके बाकी सही किए हुए क्वेश्चन को खराब कर सकता है काफ़ी हद तक. Okay, so the correct answer is, it is related to bonding of brackets, option D. So what is crystal growth technique or crystal growth theory? So basic premise behind the development of this concept was that traditionally, or you can say till now, what we do is bonding with the help of phosphoric acid. Okay, 37% orthophosphoric acid. So what it was observed was that, as we know, in orthodontic bracket bonding, the bracket bonding is temporary or for the duration of the treatment. Okay, so while debonding, it was observed that there used to occur microfractures at the level of the enamel. So what we required was a kind of bonding which is of high strength, high tensile strength, so that the bracket does not get debonding during the orthodontic therapy, and at the same time, when the therapy is concluded or is completed, the bracket comes off easily without causing any kind of microfracture or leaving any residual enamel deposits on the enamel surface. Okay, so that's why this crystal growth technique came up. So it was introduced by Majola and Smith in the year 1979 as an alternative method to acid etching for bonding brackets. So what we used to do was etching with polyacrylic acid solution which contains residual sulfate ions. It led to the, so once again another important point, in crystal growth technique we use polyacrylic acid solution. So what it did was it produced a crystalline deposit on the enamel, and in addition to, there was a slight etching which occurred that bonds the composite firmly to the enamel surface, which resisted mechanical removal as well. And this growth pattern was in the form of speleolytic habit, and the crystals were known to be of calcium sulfate dihydrate. Okay, so these needle-shaped crystals grew on the enamel surface after conditioning for 30 to 60 seconds with 40% polyacrylic acid containing 3.8% of sulfate ions. Each and every point is important with respect to this theory, which I am just mentioning right now. Okay, it produced a tensile bond strength which is equivalent to that of conventionally acid etched surface. And at the time of debonding, the fracture mostly occurred at the crystal resin interface when the bracket was pulled off the teeth. Okay, so this was the major advantage, and at the same time there was not leading to much microfractures at the enamel surface. So correct answer is it leads to bonding of brackets. Next question. Another previous year question, that's why I mentioned SNOT. Okay, is used to assess degree of displacement with TMD, muscle function of class 2 DIB1, respiratory pattern in mouth breathing, or variopharyngeal inlet outcome assessment. The correct answer is it's used for assess respiratory pattern in mouth breather. SNOT stands for simultaneous nasal and oral respiratory technique. It's a diagnostic apparatus for mouth breathing patients. Consists of a various like a plexiglass chamber in which various balls and meters are attached. Okay, what is important is it is used for assessing respiratory pattern in mouth breathing patients. And next question, a good question, you can say molar intrusion cannot be done by face mask, removal of fixed pipe plates, high pull headgear, fixed appliance. Cannot be done. What will be the correct answer here? Cannot be done. तो इस टाइप ऑफ क्वेश्चन में you can go with concept based question, not a definition or theoretical question. So how to approach such kind of question? Concept based question में you need to go by the rule of elimination. जो पता है, जो नहीं पता है, and narrow down the options then. Okay, so we have A. Okay, cannot be done by A, face mask. Okay, another A. Anyone else? Any other answer? This is the problem with this online portal. I had been sitting in front of you, I would ask why not B, C or D, or why A only. Okay, so most of you, or you can say, are giving option as answer A. So it cannot be done by face mask. A is the correct answer. Removal and fixed bite plates can lead to molar intrusion. Or someone gave B as well. No, fixed bite plates in the posterior region leads to molar intrusion. So it is known as bite plane effect. Repeated biting on that high bite plane leads to molar intrusion. High pullet gear definitely leads to molar intrusion. Okay. Extrusion in headgear is done by cervical pull headgear. And fixed appliance definitely can be help in molar intrusion. And fixed appliances may they are basically intrusion arches, or you can say rickets intrusion arches, utility arches are the some of the example. And another important thing in this is that intrusion arches work on the principle of one couple system. Now I am not going to discuss this one couple, two couple. What I want to highlight is that there is possibility that simultaneously branch out question can be formed on this. Okay, so I hope most of you were able to eliminate C and D. There was a confusion between A and B. Face mask cannot be used for molar intrusion. The other, it somewhat leads to extrusion of molar. Okay, because of the pulling effect. The maxilla is pulled in the downward and forward direction. So according along with it, the posterior are somewhat extrude. Next, a theoretical question. Physioprint is a term used to describe. So it's a photographic orientation technique that permits the measurement of facial contours and volume. Okay, just remember this. So what is this? It's a grid of light which is projected on the face to study the facial contours. It's a technique used for measurement approach in growth. If you remember, measurement approach, experimental approach, the dyes which we studied alizarin, एक्सपेरिमेंटल अप्रोच में आती है, मेजरमेंट में सेव 3D मेथड एंड ऑल. सो फिजियोपेरेंट इज अ टेक्निक इन दैट. ओके ओके अगेन सो आई शुड हैव written this answer. Okay, so safety valve mechanism for pubertal growth spurt is most काफ़ी लोगों ने there is a confusion, that's why I took up this. So what is safety valve mechanism for pubertal growth spurt? So I'll just come to it since I showed you the answer as well. Okay, so what is safety valve mechanism? So as we have seen that the mandible growth ends later than the maxillary growth. So what happens is, if the mandible continues to grow, what will happen? It will outgrow the maxilla and there will be anterior tooth crossbite. So nature has put up this safety valve mechanism so as to compensate or prevent this from overgrowth of mandible from happening. So why, first thing, why does this late mandibular growth, this late mandibular growth, the term which occurs around 17 to 18 years, okay, occur, it can lead to lower incisor crowning. So another is subsequent or branch out question which can. Now coming back to safety valve mechanism. So what does nature do is, in our human body, the intercanine width of the maxilla adjust. Okay, so maxilla की growth खत्म हो चुकी है. Maxilla means maxilla bone की growth, but the dentition, the teeth which are there, they adjust according so as to accommodate the increased or the late mandibular growth. The intercanine width in the maxilla increases. Okay, so this is what. So the maxillary intercanine width is established in another way, or another way to define safety valve mechanism is that the maxillary intercanine width establishes later than the mandibular intercanine width so as to accommodate the late mandibular growth. Okay, so to summarize, the maxillary growth finishes earlier, maxillary bone. The mandibular bone growth finishes later, but the maxillary intercanine width adjusted so as to accommodate the late mandibular growth, or the maxillary intercanine width is established later than the mandibular intercanine width. and what age they are established, it's mentioned here. So हाँ क्वेश्चन में दे आर आस्किंग अबाउट इसको वेरियस फॉर्म्स में ट्रू फॉल्स करके डेफिनेशन वाइज सेफ्टी वॉल मैकेनिज्म इज आस्क्ड n number of times. I hope now this safety wall mechanism topic is clear. Okay, since we have a limited amount of time, I'm moving ahead. Only intramembranous bone formation is seen as another multiple type answer question, correct? Okay, so in exam, as I've told you, they can give you option A in which 1 2 3 are correct, 4 is correct, incorrect, not correct, ऐसे करके आते हैं नीट में. ओके, सो एज आई डिटेलली टोल्ड यू, नीट और आईएनआई का कोई पैटर्न अलग नहीं है जो एक वो हो जाता है कि उसमें मल्टीपल आंसर करेक्ट हो जाता है. इसमें भी मल्टीपल आंसर करेक्ट है, बट ऑप्शन तो एक ही करेक्ट नीट में भी. सो द ओनली थिंग दे आर टेस्टिंग राइट नाउ इज हाउ वेल योर नॉलेज इज. ओनली इंट्रामेम्ब्रेनस बोन फॉर्मेशन इज सीन इन. सो व्हाट विल बी द करेक्ट आंसर? B, C, A and C, so I'm saying C only. So most of you are agreeing with A and C. Cranial base, okay, it's both endochondral, mandibular is E, endochondral plus intramembranous both. What about nasal? B and E. Someone has come with B and E as well. So the correct answer is, I won't waste much time now, A, C and E. Cranial vault, maxilla and nasal, which shows only intramembranous bone formation. This is a summary. Maxilla, mandible, cranial base is endochondral, nasal is intramembranous. Nasal is endo. Isn't it intramembranous? Okay, I move ahead. अगर किसी को डाउट है, because I have to end the session as well, and I want to show you one image as well, so I'll just share the ratio of width for maxillary anterior teeth for best appearance should be 50% of preceding, 62%, 75% or 42%. What is the correct answer? नो इश्यूज, अभी भी टाइम है, जस्ट याद कर लेना. if I am also wrong, you can tag me in the group. What I remember is nasal is also intramembranous. Okay, so ratio of it. Moving ahead, ये intramembranous enterochondral वाले questions they are asking repeatedly in their exam. Okay, so 62% of the preceding teeth, so it's also known as golden proportion. So this is the apparent width relationship. Why? Because of the curvature of the arch. Also part of micro aesthetics. Okay, next question. Incisor liability in maxillary and mandibular arches. Very easy question. 5 in maxilla, 7 in mandible, 6 in maxilla, 4 in mandible, 7 in maxilla, 5 in mandible. Okay, 4 in maxilla. So a very easy question. 62% is the answer. Dr. Aksha, it's B, the apparent width relationship because of the curvature of the arch, and it follows till the premolar, the first premolar. Okay, so it's 7 mm in maxilla, 5 mm in mandible. Okay, so correct, it's nearest to 7.6 mm in maxilla and 5 mm in mandible. So what is incisor liability is the apparent mesodistal difference in the mesodistal width of the permanent and the primary incisors. How it's corrected, you all know by proclination. किस किस से कितना correct होता है, you all know. Okay, so it's 7.6. और another thing जो इसमें इस टॉपिक से डेवलपमेंट ऑफ ऑक्लूजन से मेजरमेंट बेस्ड क्वेश्चंस बहुत आते हैं इंसाइजर लाइबिलिटी पे. ओके, द डिफरेंस इन द मेसोडिस्टल विड्थ of the premolars and the canine and the primary molars and the primary canines. Okay, कितना होता है 1.9 mm, 1.7, 3.4 mm जो भी है, just remember that. Okay, I have told you in the class exact values, उसके nearby 0.1, 0.2 हर किसी ने अपना variation दे रखा है. Next, so this image you should know, this is the image. In further subsections as well, each time I'll be showing you some or the different appliance image. Okay, unconventional appliances हैं, they haven't been asked, but still, so this is the image of a ELSA appliance. So it stands for expansion label segment lining appliance. So how it's used, it is used to procline the upper incisors, expand the posterior dentition and reduce the overbite aspect. Okay, so what are the components? It has a labial bow from canine to canine, occlusal rest on the premolars and the molars. This is the occlusal rest. A spring in the anterior region. Okay, Adams clasp on the premolars and molars, and a midline expansion screw. Okay, so this is the image of ELSA appliance. And just zoom it and show it to you. Not used much nowadays. Just remember them, these image. This is the image of ELSA appliance, expansion labial segment appliance and a lining appliance. Okay, so with this I'll close the session for the day, and we'll meet up with a few more MCQs in the next session. Keep studying, keep revising. If anyone has any doubt, you can always, if I missed something, I missed some doubt in the comments, you can always tag me in the WhatsApp group which you have, MDS Quest Club, or on the Facebook as well. You can message me on the messenger. Okay, and I'll be happy to answer. Okay, so keep studying. Just less than a month to go now for your exam. Okay, so we'll meet up with few more MCQs in the next session in March, and in April we'll have a revision kind of session. Okay, and I'll try to discuss some pre-YQs in that. But in March I'll form my own questions and ask you, not PYQs. Okay, so I'll close the session. Thank you for your time and joining. Okay.